ಡಿಸ್ಟ್ರಿಕ್ಟ್ ಶಾಪುರದಿಂದ ಮಾತಾಡ್ತಾ ಇರೋದು. ನಾನು ಆ್ಯಕ್ಚುಲಿ ಕಳೆದ ಒಂದು 16 ಇಯರ್ಸ್ ಆಫ್ಟರ್ ನನಗೆ ಪ್ರೆಗ್ನೆನ್ಸಿ ಆಯಿತು. ನಾನು ಅದಾದಮೇಲೆ ಒಂದು 5.5 ಮಂತ್ಸ್ವರೆಗೂ ನಾನು ಇಲ್ಲೇ ಬೆಂಗಳೂರಲ್ಲೇ ಸ್ಟೇ ಮಾಡಿದೆ ಬಿಕಾಸ್ ಆಫ್ ಬೇಬಿ ಕನ್ಸರ್ನ್. ಈ ಲಾಸ್ಟ್ ಇಯರ್ ಮೇದಲ್ಲಿ ನನಗೆ ಕೋವಿಡ್ ಪಾಸಿಟಿವ್ ಆಗಿಬಿಡ್ತು. ಅದು ನನಗೆ ಒಂದು ಸ್ವಲ್ಪ ದೀರ್ಘಕಾಲದ ಮೇಲೆ ಗೊತ್ತಾಗಿದ್ದರಿಂದ ನನಗೆ ಹೆಲ್ತ್ ತುಂಬ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಆಯಿತು. ಇಮಿಡಿಯೇಟಾಗಿ ನನಗೆ ಬೆಡ್ ಸಿಗಲಿಲ್ಲ, ಅರೇಂಜ್ಮೆಂಟ್ ಆಗಲಿಲ್ಲ. ದಟ್ ಮೂಮೆಂಟ್ ನಾನು ಇವ್ರ ಹೆಲ್ಪಿಂದ ಆಮೇಲೆ ಬೇರೆಯವ್ರ ಮಾಹಿತಿಯಿಂದ ಆಸ್ಟರ್ CMI ಹಾಸ್ಪಿಟಲ್ಗೆ ಕನ್ಸಲ್ಟ್ ಮಾಡಿದೆ. ಅಲ್ಲಿ ನನಗೆ ಅಡ್ಮಿಟ್ ಮಾಡಿಕೊಂಡ್ರು. ಆಮೇಲೆ ನನಗೆ ಪ್ರಾಪರ್ ಕೋವಿಡ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟರು. ಬಟ್ ದ ರೀಸನ್ ಏನಿತ್ತು ಅಂದರೆ ತುಂಬ ಹೆಲ್ತ್ ಭಾಳ ಸೆನ್ಸಿಟಿವ್ ಆಗಿರೋದ್ರಿಂದ ನನಗೆ ಒಂದು 11 days ನಾನು ಕೋಮಾದಲ್ಲಿ ಹೋಗೋ ಸಿಚುವೇಶನ್ಸ್ ಬಂತು.
She was admitted and after 1 or 2 days she had to be shifted to the ICU because her condition started to deteriorate. Her history with a long-standing infertility with many attempts of IVF, this too was an IVF pregnancy and a twin gestation too. This twin gestation doubles our risk as well as multiplies the challenges we go through. And in COVID ICU, we have an excellent COVID ICU team with the state-of-the-art equipment, but they were not able to give her full management, everything, all the medicines related to COVID, the antivirals, the steroids, and also her positional treatment because her lungs continued to become bad to worse. And she had to be given positional treatment. She had to be put on prone position, that is on her tummy, which was not possible. And it came to a situation that she would need ventilation. So that is when we decided, with the intensivist as well as the anesthetist, we decided to go ahead with terminating the pregnancy, that is going ahead with the cesarean section. At that point of time, it was her life only, but we had this babies very much in our mind because it was a case of infertility and with long years of waiting. And so this we decided on surgery on a particular day. This we went through an extensive counseling with the intensivist, the anesthetist and the neonatologist, where the neonatologist counseled her regarding the challenges the babies, because of extreme prematurity, they will be going through what after delivery, and also to mentally prepare them for this. She was not in a position for counseling. Her husband was there, and after this extensive counseling, we decided on the surgery. With an excellent anesthetic backup, we took her up for surgery, which was very challenging because we had to do it very fast, because we could not expose her to anesthetic medications for long. And one more was she had to be propped up. We did the surgery in almost a sitting posture. Her lungs were quite bad. She could not be put on a flat surface. So after the surgery, we of course brought out 2 tiny tots, about 500 grams, and handed over to the neonatologist.
One of the babies required sedation, so other baby was smooth. So both got electively intubated, required the necessary surfactant for the early RDS. So then we cared the babies from the incubators with aseptic protocols. So TPN on flow from the day 1. The babies were smooth on the day 1. These babies had like a stormy course with cytokine storm kind features, with all the counts, neutropenia, thrombocytopenia, septic markers going high, and babies hemodynamics getting altered, going in shock. We could manage with a proper care, with proper protocol in place, with early interventions, putting on them on probably high-end ventilators like HFO, giving the repeated surfactant, giving inotropic supports, monitoring non-invasively, so handling with aseptic care, and starting the immunomodulators like IV immunoglobulin. We have an excellent team of NICU nurses who are trained well, follow strict aseptic protocols, do proper TPN. So we care 24/7 with a full cover of specialists round the clock. So then we have in-house monitors for like probably bedside neurosonogram, bedside echo. So the pediatric ophthalmologist screening for ROP, doing the laser in-house. So pediatric surgeon on call for the emergency setup like early NEC kind of features when we need a consultation. All this can be provided in-house. So during the COVID situation also, So these babies had all the features of what extreme preterm can give us. So the lung problem with severe radius, the PDA opening up and having a stormy course, having a pulmonary hemorrhage, so high end ventilation like HFO, repeated surfactants, so prolonged TPN. So then early nutrition was started. So with like donor milk, we escalated the feeds. One of the baby apparently sadly succumbed to NEC. So other baby like probably was well managed. So took time, but the baby responded well for our treatment. So because of the cytokine storm, neutropenia and thrombocytopenia, baby has to be on prolonged antibiotics and immunomodulators like IV immunoglobulin. So overall, we are happy to tell today that so with all the hard work what we did for almost 3 months, the baby is doing well, and now so we can see the baby smiling back with us, recognizing the mother, holding the head at 3 months of corrected age. So this is what we can say, and similar things happened to almost like 20 babies who are delivered say from 24 weeks to 30 weeks during the COVID pandemic.
After the surgery was done, thankfully no untoward incident happened there. We stabilized her and shifted her back to the COVID ICU. There she had a stormy stay. She had to be ventilated. She was almost not responding for quite a few days, 10 to 12 days. And then slowly, with all the treatment and the backup of the COVID ICU team, she came out of it after a month or so in the ICU stay. And then now seeing there with all this at Aster, we could do it because it is a quaternary care hospital. With all this and seeing their happy faces with the baby now after 3 months or so, we feel it's all worthwhile. Thank you.